Good day, I am Professor Rationale, Head of Department of Nursing within the Faculty of Health Sciences at the University of Johannesburg. It is my great pleasure to introduce to you Postgraduate Diploma in Midwifery program. Postgraduate Diploma in Midwifery is a 2-year specialized and professional program which leads to registration of qualified students by the South African Nursing Council to practice as midwife specialists. This program is also approved by the Department of Higher Education and the Council of Higher Education. The Postgraduate Diploma in Midwifery program is at National Qualification Framework Level 8. Therefore, it will enable articulation of midwife specialists to master study at NQF Level 9. Its mode of delivery is contact, and it will be offered on a part-time basis. The total credits of Postgraduate Diploma in Midwifery is 120, which is equivalent to 1,200 notional hours. And it includes theoretical and work-integrated learning components. For work-integrated learning, midwife specialist students will be allocated in healthcare facilities that are approved and accredited by SANC for the University of Johannesburg. We are also pleased to announce that the University of Johannesburg is the first university in Gauteng province to be granted a full accreditation status for postgraduate diploma in midwifery by the South African Nursing Council. The university is geared to produce future-orientated midwife specialists that are ready to face maternal and neonatal health challenges of the 21st century and to work towards attainment of the Sustainable Development Goals. The Postgraduate Diploma in Midwifery program came about because of the South African Nursing Council decision to align nursing qualifications to the National Qualifications Framework. And it initiated the provision to phase out legacy qualifications and phase in competency-based postgraduate diploma programs. The program is also aimed at addressing shortage of midwives specialists in the country, as determined by the National Department of Health and the South African Nursing Council. The program is specifically designed to strengthen and deepen students' knowledge and expertise in midwifery as a specialty of the nursing profession. This specialized program is competency-based and it focuses on expanded roles, responsibilities, and accountability to improve reproductive, maternal, and neonatal health based on current thinking, practice, and research methods in the field of midwifery. The qualifying student from the Postgraduate Diploma in Midwifery will gain knowledge, skills, norms, values, and attitudes, as well as basic and advanced clinical competencies, which are recognized nationally and internationally. The midwife specialist will be able to work independently within the multidisciplinary team to undertake professional and highly skilled work in midwifery care. This includes prevention of pregnancy-related complications, screening, appropriate management, and prompt referral of patients with specific and complex health problems. Midwife specialists create and maintains a therapeutic environment, communication, and healthy working relationship with childbearing women, their families, and the multidisciplinary team, which includes traditional birth attendants, non-governmental organizations, and support groups. They are also responsible and accountable for the provision of midwifery care, support, and health advice to low and high-risk women during preconception, pregnancy, labor, and postnatal period within ethical, legal, and professional framework. Midwife specialist has knowledge and expertise to critically analyze, plan, and provide compassionate and respectful midwifery care to promote the health of individuals, families, communities, and populations through screening and early identification of pregnancy-related risk factors. They are experts in promotion and encouragement of positive parenting and family practices at local, national, regional, and international levels. Midwife specialists conduct comprehensive community assessment, critically analyze, identify health problems which might put the health of mothers, neonates, children, and women at risk, and formulate a community diagnosis. They conduct comprehensive clinical patient assessments during preconception, pregnancy, labor, postnatal, and neonatal period. Critically analyze, interpret, identify risk factors, and formulate a midwifery diagnosis. Then they design a midwifery care plan to address risk factors as highlighted in the midwifery diagnosis to prevent complications and to improve patient outcomes. To implement the plan, they provide quality, compassionate, and respectful midwifery care interventions using an integrative approach which includes basic antenatal care, prevention of mother-to-child transmission, essential steps in managing obstetrical emergencies, kangaroo mother care, neonatal care, and integrated management of childhood illnesses. To determine the appropriateness and effectiveness of assessment, diagnosis, planning, and midwifery care interventions, they conduct monitoring and evaluation. Furthermore, midwife specialists continuously and critically analyze the implementation of the existing standards to determine if there's a need to develop quality improvement tools. Midwife specialists will be actively involved with childbearing families at home, in the community, primary healthcare setting, community health centers, maternity and midwifery obstetric units, within the public and private health facilities. Furthermore, midwife specialists work in policy development, research, education, and in scholarships. For you to be admitted to the postgraduate diploma in midwifery, you need to have the following: a bachelor's degree in nursing, R174, or a bachelor's degree in nursing, R425, or a diploma in nursing, general nurse, R171, with advanced diploma in midwifery, R1497. In addition to the qualifications, you need to have a minimum of 2 years experience, which include a year of community service as a professional nurse or as a general nurse and midwife. And proof of registration with South African Nursing Council as a professional nurse or as general nurse and midwife. You also need a proof of employment with details of midwifery experience in years. And you need approval letter from nursing service manager to register for the program and to rotate through midwifery and maternity units. For you to be selected for postgraduate diploma in midwifery, you need to submit a signed agreement from nursing service manager and or preceptor to assist with the practical component. A signed nursing service manager agreement to move to a clinical training facility which is approved and accredited by the South African Nursing Council for the University of Johannesburg. A minimum of 2 years midwifery experience, professional indemnity, and letter of permission from clinical preceptor pledging the clinical academic support. The recognition of prior learning requirements in this program is specific to the learning outcomes and assessment criteria of the program or its modules, and not primarily the content. Applicants are required to submit preliminary assessment evidence to the Faculty of Health Sciences, recognition of prior learning officer or midwifery academic staff member. Where applicable, the assessment evidence must be verified by the employer, and it must be relevant to midwifery, current, sufficient, authentic, and valid, and in the form of midwifery portfolios and challenge examinations. Upon receipt of the portfolio and challenge examinations, the applicants will be issued with the acknowledgement of receipt of evidence. The evidence will be assessed to determine the preliminary assessment outcome as successful or unsuccessful. Successful candidates will be allowed access to further study, but not the award of the prerequisite qualification. A midwife specialist is a registered professional nurse and midwife who has advanced expertise in midwifery. They are registered with the South African Nursing Council as midwife specialists. Midwife specialists are competent to work independently as clinical specialists, educators, consultants, leaders, managers, researchers, change agents, and advocates for mothers, neonates, and their families. They differ from basic midwives because they critically reflect, interrogate, plan, manage, and engage with different health professionals involved in the care of women and neonates. Midwife specialists possess knowledge and understanding of research terminology and techniques to apply in midwifery practice. The 2022 enrollment is now open for applications, and the closing date for applications is Monday, 31st January 2022. The commencement date of the course is 14 February 2022. Apply online via www.uj.ac.za. Email inquiries to evandenberg@uj.ac.za, or contact us on 011-559-6704. We look forward to welcoming you to the Postgraduate Diploma in Midwifery program at the University of Johannesburg.
The University of Johannesburg, the future reimagined.